Well, hello everyone, and a very warm welcome to our latest video with Dr. David Grimes, all about vitamin D. Now, some of you may already know of David Grimes. He's one of the UK's experts on vitamin D. You may have seen him being interviewed on Dr. John Campbell's very popular YouTube channel, as I did. That's where I came across David. But I met a colon hydrotherapy colleague and friend of mine a few weeks ago, and Dr. Grimes was a guest speaker at her conference, her colonics conference, and she also recommended him. So here I am. I'm going to invite David into the video in a moment. Now, the videos that, or the interviews that David did with Dr. Campbell were quite scientific. This interview is going to be more sort of vitamin D for beginners, a bit sciencey, but I want to make it understandable for you. So I'm going to invite David into the video now, and he can tell us a little bit about himself, and then I have a few questions to ask him. So here we go. Hello, David.
Good evening, Linda. Nice to be with you.
Good evening to you, and it's lovely to be with you again, David. So first of all, it would be lovely if you could tell us a little bit. As I just said, David, I know the interviews that you've done in the past, certainly the ones that you've done with Dr. John Campbell, have been quite in depth, if I remember, about vitamin D and quite sort of science based. So this interview with you that I'm doing now, I'd like it to be sort of more for people who have a bit less understanding of vitamin D and how important and yeah, I want people to understand how important vitamin D is to their health and well-being.
Well, we can't really escape the science, I'm afraid. But it's not as complicated as you might think. And people tend to be a bit frightened of science. Now, I'm an active member of the Clitheroe U3A, which you may know of, U3A. And I run the group that is Science and Scientific Enlightenment. And it's to try to provide scientific enlightenment to people who have no background knowledge of science, not in depth. And the tragedy is that people tend to fall into two groups, the sort of the arts side and the science side. And the science side is the great minority. And whereas science background people tend to have a good knowledge of the arts, people with an arts background tend to be frightened of science and have no knowledge of it. And it's a very, very serious problem. But we're not going to put it right this evening. Anyway, I just hope that.
Oh, well, I think the people of Clitheroe, and certainly the people of Clitheroe U3A, are very, very lucky to have you and your science group.
Yes, well, it's quite popular. We cover a wide range of subjects.
Yes. What are you covering at the moment? What's the topic at the moment?
Well, in September, where we do different times, U3A is a sort of self-help group. And one of the members in September, the next meeting, is going to be talking about aircraft, short and vertical takeoff aircraft. Not too technical, I don't think. And in October, it's going to be the development of recorded music or recorded sound. And then in November, we've got someone talking about the work of medical physics, the application of physics to medicine. And then Christmas, we'll have a little. December, we have a little Christmas do. And in January, I will be talking about genetics, introduction to genetics. Talk about all sorts of things.
Oh, so is that particular group quite popular with the ladies?
Yes, it is actually. Yeah, it is indeed. About 50-50 men and boys and girls, as it were. Yeah.
Okay, then, David, that's great. So, yes, who is Dr. David Grimes? Can you tell us a little bit about yourself, please,
yes,
David?
Scratch my eye, which is itching a bit. Well, my name is David Grimes, you can see, and I was born in 1943 in Salford, and went to school in Prestwich and Whitefield in North Manchester, and then went to Manchester University in 1961. And from 1961, I spent 16 years training to do the job as a consultant physician. It sounds a long time, and it was a long time, but I acquired a huge amount of knowledge and experience in that time. And the training is now shortened, but there's a loss of experience in the shortened training. Whether that's a good thing or not, I don't know. Anyway, in 1977, I came to work as a consultant physician in Blackburn, in Lancashire, which you may know of. And I live in the Ribble Valley, which is a bit north of Blackburn. And I live midway between Blackburn and Clitheroe. So it's a beautiful part of the world. It's quite wet. A few minutes ago, the sky went black. We had a most enormous shower. Well, it's been quite nice this afternoon. Anyway, we just put up with the wetness. Can't do anything about it. It makes everything grow.
Yes, it does, yes.
There we are. So as a consultant physician, I specialised in overall general medicine, a lot of emergency work, and also I specialised in gastroenterology. Had to specialise in something like that. So I chose gastroenterology. In stomachs, intestines, liver, pancreas.
What drew you to gastroenterology? Anything in particular?
No, it's just the way the wind was blowing. The wind blew me into a gastroenterology job, basically. It could have been anything, but that's the way it worked out.
Okay.
I had no great ambition to specialise in gastroenterology, but that's the way it went. Well, anyway, there we are. So specialising, doing a lot of general medical work and emergency work gave me a big awareness of the amount of illness in the locality of Blackburn, Darwen and Accrington, and also Clitheroe. But there's not much illness in Clitheroe compared to, in the Ribble Valley, compared to Blackburn, Darwen and Accrington. And that struck me as being puzzling. I was just looking up the other day, the top healthiest places to live in England. The first one, according to one study, the one is Harrogate, Rutland, and number 9 is Ribble Valley, which is where I live.
And where's Blackburn?
Down at the bottom is Blackburn. It's very near the bottom, I'm afraid. The health score in Harrogate is 124.9, in Ribble Valley is 121.9, and the health score in Blackburn is 76.5.
And yet Blackburn's not too far from the Ribble Valley?
Just about 6 miles away.
Oh, okay. So
I would drive 6 miles to work in the mornings.
So what caused this? I mean, I'm assuming that you then began to look into the disparity back then.
Right. That was the disparity. Now, Blackburn is quite a poor town, you know, in respect of average income. And there's clearly a relationship, it's shown time and time again, a link between poverty and ill health. And the other one is ethnicity and ill health. And Blackburn has a large South Asian ethnic population. And again, the health profile of that group is terrible. And so I was very, very concerned about this. Nothing to do with gastroenterology, but I was very concerned about humanity, as it were, and the unfairness in life, and the unfairness of people living in Blackburn had a poor health profile, and the unfairness of people in Ribble Valley having a very good health profile. It didn't seem to.
So David, I'm sorry to interrupt. So this had nothing to do with access to medical, you know, to GPs and to you know, to medical services.
No, nothing at all. No.
Okay.
No. We hear a lot about access to GPs and hospitals today in 2024, but I'm talking about 1980 when there wasn't a problem. Waiting lists were very short. There was no problem getting access to doctors and health facilities. None at all, no.
And what kind of health issues did the people in Blackburn tend to suffer with?
Well, short lives, basically. They died much earlier than people in Ribble Valley. You know, there's a difference in average age of death of about 5, 10, 8, 10 years. It was
Okay.
quite remarkable. And if you look at the ethnic South Asian group, again, the average age of death, I'll come on to that. Well, I'll tell you now. During the COVID-19 pandemic in 2020, there were 26 doctors in the country who were working doctors in the country, died from COVID-19. Those 26, one was white, and 25, that's 95%, were ethnic South Asian or Black African.
I do remember that. I do remember seeing their photographs. Yes.
And and this was never acknowledged officially at all. And then in the British Medical Journal, there were about 23, I think it was, case reports, no, obituaries to doctors who died during 2020, not of COVID-19, just died of various reasons. Now, half of them were white, with average age of death of 87 years. The ones who died, ones of ethnic minorities, Black African, South Asian, their average age of death was 67. A 20-year difference. And it's terrible.
But I'm assuming, David, that these doctors who died, these Asian and Black doctors who died, did not have poor diets and lived in poor areas.
No, that's right. It is well known that South Asian and Black African people have a high mortality and an illness, and it's put down to racism. You know,
is that regardless of where they live?
Yeah, this is the sociologists have got a stranglehold, as it were, over explanations, and it's all wrong because they don't know anything about science, the sociologists, but they're the ones who control the narrative. But if you look at doctors of any ethnicity are far from poor. You know, these are people who all had incomes of about £100,000 a year, you know, and nice houses, you know, well, £100,000 a year upwards. And these people were not poor. They lived in nice houses. And a lot of my neighbours are doctors of an Asian ethnic background. But this wasn't, it was all put down to racism and poverty. It was wrong. But no one has taken seriously this ethnic consideration.
But you have. I know that you have, and you've researched this, haven't you?
Yeah, that's right.
Over many years, over decades.
Yeah, absolutely. Yeah.
So what did you conclude then, David? And what's the link with vitamin D?
Well, I looked at this and I thought that there are other factors. For example, comparing the northwest of England to the southeast. And this morning I was talking on the telephone to my younger son who lives in Essex, in Kelvedon in Essex. And he was out taking his dog for a walk in lovely sunshine. And it's about 27 degrees, he said. Well, I was sitting at home with the rain pouring down all morning. And the temperature was about 20 degrees or something like that. Huge difference in the climate. That's the issue. So I did a lot of research looking at the standardized mortality of a lot of towns in England, together with the hours of sunshine, which are obtainable from the Meteorological Office. And there's a very strong correlation, association. The more sunshine per day, the better the health profile and life expectancy. So, well,
and was this something that you were digging into back in the 1980s then?
Yeah, that's right.
Okay.
Yeah. 1980 to 1990 was doing all the research, most of the research. and I published as an MD thesis in 1993. So it's all gradually building it all together. And then I thought, well, the Asian people who are there, we know they've got low vitamin D levels. I learned that when I was a student, basically, or a young doctor. There's a Professor Stanbury in Manchester, who a very, very bright fellow, that was his research, was all about vitamin D. And I never forgot the work he was doing. And he did a lot of work in conjunction with Rochdale, which has a high South Asian population as well. And he identified the low vitamin D levels. He compared them with vitamin D levels in Pakistan as well, and they were low compared to Pakistan. So I was aware of that. And also there's a high incidence of tuberculosis among the Asian population in Blackburn. And it's well known that tuberculosis is strongly associated with poor immunity and vitamin D deficiency. So there was the other clue. There was so much is known about the health profile of the South Asian population in respect of vitamin D and the problems of having low vitamin D levels.
And is this purely to do with the colour of their skin, because they've got darker skin?
Yeah, that's right.
That's it, yes.
It's a genetic factor. And the genetic factor is that they have dark skin, which is fine living in Pakistan, India, which not altogether fine, because they may cover themselves up with clothes and have an indoor life. And it's interesting, there's been research done in India in about the 1920s, brilliant bit of research, and it showed that the poor people have far better health than the wealthy people, because the wealthy people stay indoors and the poor people are working in the fields. And the difference was staggering. And the Scottish person who did the research, the study, he noted that rickets, which is severe vitamin D deficiency in children, rickets and tuberculosis ran together in the same families. It's all linked to vitamin D deficiency. This was known 100 years ago. Nothing's been done about it. The neglect of the ethnic minority people in this country in respect of health profile is a disgrace, quite honestly. It's time that somebody took vitamin D seriously.
We'll come on to that a little bit later, David, but if you can just explain, please, what exactly vitamin D is.
Vitamin D is a hormone, and it should be called cholecalciferol. It isn't, for reasons I'll come on to. So it's a hormone that's produced in the skin. The skin is the body's largest endocrine organ. We've heard of the pancreas, and we've heard of the thyroid, but the skin is a huge endocrine organ. And the skin produces an oil, and this oil is called 7-dehydrocholesterol. For short, it's 7-DHC. And we know we have an oily skin. It's natural. I'm sorry, my phone keeps making a noise. I don't know if you can hear it.
Is that your phone, David? I didn't know it was mine, actually. So someone's obviously sending you messages, aren't they?
It's my children. They're all sending messages through. My 3 children are sending messages to each other, and including me in it.
If you put it on silent, will it turn that pinging off? I've put mine on silent.
I put it under the table. I should have done. Yes, I put it under the table. We can't hear it now.
Okay.
Sorry about that.
That's fine.
Right, where were we?
We can hear you loud and clear.
We have an oily skin. We have an oily skin, which we all know about, and people.
Less oily as we get older, though, David, and as we go through the menopause.
Well, yeah. Absolutely, that's the point. So the sun acting on the skin converts this physicochemical conversion of 7-DHC into this hormone cholecalciferol that we know as vitamin D. Now, as we get older, our skin becomes dry, and therefore older people cannot produce enough vitamin D, no matter how long they spend outside in the sun. They cannot make enough vitamin D. All elderly people are vitamin D deficient.
That's
They
really
all
interesting.
need a supplement.
That's such a
Every
good
one of them.
point. Yes.
Yeah,
Mm.
very important. We should not recognize. It was always said during the COVID that older people are vitamin D deficient because they don't go outside in the sun. Nothing to do with that. It's because the skin's dry. They don't
Yes.
have the precursor, as it's called, the
Mm.
7-DHC oil. Anyway, so
Mm.
that's normal. So the oil is converted into vitamin D. We'll call it vitamin D because that's how we know it.
Yes.
And that goes in the blood into the liver. And in the liver, it's gradually changed, chemically changed, very slow process, into what's called calcifidiol. And it circulates in the blood as calcifidiol. And it sits there waiting until it's needed. Now, it's not only us that produces the oil 7-DHC. It's been produced for 1.5 billion years by plankton.
Mm-hmm.
What happens? Plankton, I've just been reading about plankton. There's a very good article in The Guardian last week on plankton. And plankton they live on close to the surface of the oceans, and they're very vulnerable to damage by ultraviolet light from the sun. So they have two mechanisms of protection.
Mm-hmm.
One of them is called diurnal vertical migration, in that during the daytime, they sink down to a deeper level so they don't get damaged by UV.
Mm-hmm.
And in the nighttime, they come to the surface. The other mechanism of protection is they make 7-DHC, this oil, 7-dehydrocholesterol. They make that oil, and when the UV shines on them, as it were, when exposed to UV, it's converted into vitamin D. Now, plankton have no use whatsoever for vitamin D. It's a waste product. They have a sunscreen called 7-DHC, and the 7-DHC absorbs the energy, the ultraviolet light, and converts it into vitamin D. So it's a waste product. So for about 1 billion years, it was completely useless to evolution. And then about 500 million years ago, we got evolution was producing more complex animals. And they needed vitamin D for immunity and ultimately for a bony skeleton. That was only about 150 million years ago. So fish.
I think I know where this is going. Carry on.
Fish eats plankton.
Yes. Yes.
And fish can't produce vitamin D. We know very well that they are rich in vitamin D. They can't make it themselves because they live deep in the ocean, and they have thick scales. So the sun can't do anything. They don't produce 7-DHC. They don't produce vitamin D, but they can eat it. So little fish eat plankton, and big fish eat little fish, and we eat big fish.
Yes.
And so we can also get vitamin D from eating fish. Very good. And that's what we do.
Some of us do. Some of us eat fish, yes. Or we're talking about oily fish, the oily.
Yeah, oily fish, yeah.
Yes.
Yeah. I think they say oily fish, but I think all fish basically. I think oil.
Okay.
All fish ultimately eat plankton.
Yes.
Just fish. Yeah, let's not complicate it. Just eating fish. Even little fish, even prawns are very good. I saw a man in the outpatient clinic a number of years ago when I was working, and he was a man who with quite severe learning difficulties. And he came to the clinic. I can't remember why, but I think he had difficulty with mobility. And so he never went outside. I think he came in a wheelchair. He never went outside. And I thought, I bet this man is vitamin D deficient. So I checked his blood level, and it came back really high. So when he came back to the clinic, I said to him, he didn't quite understand himself. I said to his carer, does he go outside and sit in the sun? Oh, no, he never goes out. I said, does he eat fish? She said, well, he eats prawns. I said, in fact, she says, that's all he eats. He eats prawns 3 times a day.
Wow.
And that's what's doing it. And that's why I have plenty of vitamin D on board.
Ah, yes,
So
yes.
the why I couldn't walk was an entirely different thing, not vitamin D deficiency. Remember these?
Okay, David. So, yes,
I'll tell
why
you
do...
about another patient, actually, another person.
Oh, go on, do
This
share.
is a man of South Asian ethnicity. He's actually from Bangladesh. And he came to the clinic, and I had a high awareness of vitamin D deficiency in South Asian people. And I can't remember what was the matter with him now, but I thought, well, I'll check his vitamin D level. And I did, and it was really high. And when he came back to the clinic, he said, do you go out in the sun a lot? I said, no, I try to avoid the sun. He says, I don't like the sun. I prefer to be indoors. I said, you got a high vitamin D level in your blood. Do you take a supplement? No, he said. I said, do you eat fish? Oh, yeah, I love fish, he said. I eat fish 2 or 3 times a day. I said to him, what sort of fish do you eat? He said, oh, I eat Bangladeshi fish. I said, well, where do you get Bangladesh fish from? He said, I get it from Tesco. So I go along to Tesco in Accrington, and there it is in the frozen counter, Bangladeshi white fish frozen.
Did it say that on it? Bangladeshi white fish?
Yeah.
Oh.
Only small.
What kind of fish was it?
I've no idea. It was white fish, that's all I know. Small white fish. I don't know the actual biological variety at all. But it just shows how people can get good blood levels of vitamin D from eating seafood. Basically.
Seafood, yes.
Good for them. And that is why vitamin D is called vitamin D, because we take it as a vitamin, a chemical we take from outside the body, because it's thought we can't produce it ourselves. Well, we can produce it ourselves, actually. But it was noted that children with rickets in Glasgow and with tuberculosis, if they were given fish oil, when they were ill, they were sent back to the fishing villages where they came from, and they were given fish oil, and their health improved enormously. And that was how vitamin D was discovered, from fish oil.
You know, years ago, David, I'm not sure if I dreamt this, but you know, years ago, were school children given a spoonful of cod liver oil every morning? Yeah. I didn't dream that, did I?
Yeah, they were given cod liver oil.
Yeah.
And even when I was young, children went to sunshine clinics. And a sunshine clinic was where...
I don't remember the sunshine clinics, but I do. Well, I have read about them. Yes,
I've seen them written down. In fact, it was written down on one of the papers in the Royal Blackburn Hospital. Anyway, they would sit around an ultraviolet lamp. They would sit with the knickers and goggles on and sit around in a circle around the ultraviolet lamp, giving them vitamin D.
Were these children who had tuberculosis and rickets then?
Possibly, but I don't really know what they had. They might have been which might be called sickly children. You know, they might have had, I don't know what they had the matter with them really, but it was well known that there was a high risk of rickets in the area in Manchester, Salford in those days.
Okay, so why do we need vitamin D then, David? What are the major health benefits of vitamin D?
Well, we need a small amount of vitamin D when we're born. We need it for survival, really. But in particular, the first thing that's known is rickets, bone disease in children, bendy bones, deformities, bow legs, what have you, funny hands, and chest wall. And women, girls, would develop contractures of the pelvis, which made ultimate childbirth a complete nightmare for them.
Yes, yes.
And, you know, Glasgow was well known for the expertise in midwifery and obstetrics in sorting out problems of birth through a contracted pelvis. the result of childhood rickets.
So the pelvis didn't move during labour. The pelvis didn't move.
Yeah.
Didn't expand. Yes.
In fact, moving on in pregnancy, there are high risks in pregnancy, delivery, and neonates among the South Asian women and Black African ethnic women in this country. It's put down to racism.
What do you mean it's put down to racism? I don't know what you mean by that. It's put down to racism.
Well, that's just what is said. It's put down to racism. I don't know what it means either, really.
When you're trying to highlight a health issue,
yeah,
that may help these people.
Yeah, absolutely.
It's put down
to there've been 4 articles in The Guardian this year about the detrimental effects of health in Black African and South Asian women and children, and it was all down to racism. But there was never a mention of vitamin D.
Vitamin D.
Yeah.
And I know how passionate you feel about that, David.
Now, correcting racism, whatever it means, is very difficult. Correcting vitamin D deficiency is easy. It's as simple as it's simple and cheap, and it needs to be done.
We're coming on to that later.
Yeah. Now, coming back to what vitamin D is needed for, it's needed for immunity. And this is the big thing, immunity now. So people with
and that's why, sorry, David, that's why it was so important during COVID.
Absolutely. During the COVID pandemic in 2020, we learned an enormous amount about the benefits of vitamin D. Absolutely astounding amount of information came through, but it's not been acknowledged officially, I'm afraid. You know, I don't know why, it's another matter entirely. But immunity, the first thing about immunity is tuberculosis. When people's immunity goes down, is damaged, there's a high risk of tuberculosis. And we saw that during the AIDS pandemic at the end of the last century. AIDS came to the note because the sufferers were experiencing tuberculosis.
Tuberculosis, just to be clear, David, it's a bacterium.
It's a bacterial infection, mainly of the lungs.
Yes, that's right. Yes,
absolutely, yeah, it is. And people die from it. These days we have medicines against it, but
we are vaccinated in this country, aren't we, against TB? Are we?
Yeah.
Is it part of the childhood vaccination program?
Yeah, it's doubtful if the BCG, it's called, is of much value, but when the people have infection, there are 2 things that are necessary. Any serious infection. One is immunity that works, and secondly, antibiotics, if they're available. We need those 2. And antibiotics plus immunity, good news. And for tuberculosis, we have some very excellent antibiotic drugs, antibacterial drugs now. But during the course of this century, there's been a great increase in sunlight exposure. People going on holiday to Manchester to Blackpool for 2 weeks in the summer.
From Manchester to Blackpool.
Yeah, that's right.
So Blackpool does get sunshine, does it?
It does. It does indeed, yeah.
I know it does. I'm pulling your leg. I've been to Blackpool many times.
Yeah, indeed. That's right. That's right. So immunity.
Yes.
So what we can do now is measure the amount of vitamin D in the blood. For some reason, this is discouraged. If you go to your family doctor and say, could you check my blood vitamin D level, please? He'll say, it's not necessary, go away. I'm not going to do it. Now, I went to get my annual blood test done last week, and I said to the nurse, could you include vitamin D, please? Yeah, no problem, she said. And it was done. And I've got a very, very good level of vitamin D. I got the result just today. I've got an excellent blood level of vitamin D, which makes me feel very happy.
But you supplement, don't you, David?
I do indeed, yeah. I take a very high dose. No, it's not a very high dose.
We're going to come on to that later. Don't let's digress.
Okay, where are we up to now then?
Well, you mentioned about immunity as being
Yeah.
a health benefit of vitamin D. And of course, you mentioned bone health as well to help prevent rickets.
Yeah.
Is there anything else? Any
Well,
key health?
what I'll just say is that although vitamin D is produced in the skin and it's a hormone, despite that, most people, about 85% of the population and 95% of the South Asian population, are seriously deficient of vitamin D, have suboptimal levels. No question. The reasons: we don't spend much time outside. Children go to school indoors. People work indoors. If it's very hot, we often stay indoors for just to keep cool. And in most other countries, have air conditioning when it's hot, so people want to go into the air conditioning. We wear a lot of clothes, and basically, we don't get a lot of vitamin D sun exposure.
So David, okay, then just let me think this through. So we know it's important to get outside. Is it important that the sun is shining? I know it's a silly question, but is it important that the sun is shining when we are outside?
Well, the sun must be at an angle of greater than 45 degrees above the horizontal.
Okay.
To be effective. That means when it's higher than that, it's shining through less air, and as it shines through the atmosphere, the ultraviolet is absorbed by the atmosphere.
So the higher in the sky the sun is, the better it is.
Well, the stronger the ultraviolet.
The stronger.
In the tropics, of course, it's overhead.
Yes.
So there it's very, very strong.
Yes.
Which is why people with dark skins can survive in the tropics. People with white skin could not survive in the tropics without extensive clothing, indoor life, and at the present time, sunscreens.
And how much of our skin should be exposed at any one time then?
Well,
I suppose it depends on the time of the year.
Yeah.
We can have beautiful sunny days in the winter, but it can be freezing cold.
Yeah.
Which I suppose
really we should expose a lot of our skin to the sun, but we don't.
No.
When do we do that?
And how long do we need to expose it for?
Yeah. I have an allotment, and on a nice sunny day on the allotment, I wear my shorts and I take my shirt off. So there's plenty of my body exposed to the sun. But not many other people on the allotments take the shirts off, I must say, even though I think they're frightened of the sun.
Do they think you're a bit odd, David?
Oh yeah, they do. Yeah.
There's nothing wrong with that, is there?
No,
nothing wrong with being a bit odd.
Yeah, that's right. Absolutely.
Okay. So, yeah, me being the founder of a supplement company that helps people who have common stomach and gut issues, I'm particularly interested in inflammatory bowel disease, IBD, and the link with vitamin D. And I know when you were working in hospital in Blackburn, you saw a correlation between inflammatory bowel disease and vitamin D. Is that right?
Very much so. Excuse me. I tend not to use the word inflammatory bowel disease, IBD.
Oh, what do you use?
IBD gets confused with the IBS, irritable bowel syndrome. So I use the words ulcerative colitis and Crohn's disease.
Oh, you use the proper terminology. Okay, that's good.
They are different diseases.
Different disease. They are very different, yes.
Totally different diseases, yeah.
Yes.
They can be confused until what is known, but ulcerative colitis is not related to vitamin D deficiency, according to my research. Crohn's disease most certainly is. Crohn's disease is very much associated with vitamin D deficiency. And it requires treatment with vitamin D. See, in Crohn's disease, there is an impairment of immunity. People say it's an autoimmune disease. I don't believe that it is an autoimmune disease, quite honestly. That's a silly expression. I think it's due to bacteria, which ones I'm not quite sure about. The main one that came up was one called MAP, Mycobacterium paratuberculosis, subdivision. Can't remember it now. Anyway, it doesn't matter. It's something related to tuberculosis anyway. So, but the important thing is to put immunity right. And there were some very good examples of vitamin D being very effective in Crohn's disease. So I'm happy.
But you know, with Crohn's disease, David, you know, there's a lot of, well, there may be a lot of ulceration, inflammation in the small intestine.
Yeah, that's
So
right.
wouldn't that impair the absorption of the vitamin D?
No,
No.
no,
Okay.
not at all. Not at all.
That's good to know.
No. The vitamin D is absorbed in the upper part of the small intestine, in the jejunum.
Yes.
And there's no problem with its absorption at all. No.
Okay. So anyone with Crohn's disease then should have their vitamin D levels checked.
Yes, they should.
Right.
They should, and they should be on they should be on a vitamin D supplement. But anyone who's on a vitamin D supplement should have the blood checked to make sure that the supplement is achieving what we want it to achieve. It's like with diabetes. You don't sort of give somebody insulin and say, go away and take this insulin. You check the blood level for a response. If you've got an underactive thyroid, you don't say, oh, take these thyroid tablets and go away. You check the blood level to make sure they're doing the job.
Well, at least once a year. Yeah.
Yeah, that's right. And the same thing should be done with vitamin D. It's no good. It's no good taking. In fact, I was just watching a John Campbell YouTube this morning, and he'd been taking vitamin D, and he did a blood test on the YouTube of testing himself his blood level, and his blood level was quite low. It was 55 nanomoles per liter. Now,
what should it be?
Well, mine is 169 nanomoles per liter.
Wow.
Well, I take twice as much vitamin D as he does, and I check it, and it's fine. And he's bigger than I do. And
he's a tall chap, isn't he, John?
Yeah. There's a problem with people who are obese. I don't want to call John Campbell obese, but he's big. Anyway, and if people are obese, there is a problem with vitamin D deficiency, because the vitamin D that they make in their bodies from the skin, or which they take by mouth as fish or as supplements, it goes into the fat cells of the body and it gets trapped in the fat cells. And so if an obese person and a non-obese person have the same amount of sun exposure controlled, the obese person will put the blood level of vitamin D up only half the extent of the non-obese person. So they need to take twice as much vitamin D as everybody else, but they need the blood level checking to make certain it's got there. The ideal blood levels should be between 100 and 150 nanomoles per liter.
Okay. I'm just scribbling that down.
Yeah.
So are you going to contact John and tell him that he needs to increase his vitamin D?
I have done it. Yeah. I sent you an email after watching it. Yeah.
I thought you would.
I did indeed, yes. Indeed.
So have we got what causes a vitamin D deficiency? I think we've kind of covered this, some of it anyway. What
causes it? Obesity, being elderly, having a dark skin. See, having a dark skin is a sunscreen. The dark screen is protective against the ultraviolet light, ultraviolet energy in the tropics. Now, it's not random that white-skinned people are found in Northwest Europe. It's that this is where we can live comfortably. Whereas if white-skinned people are in the tropics, they have a bad time.
I'd be very uncomfortable. I don't tolerate the heat very well at all.
No, you need to keep in the shade all the time. Now, there's an illness called vitiligo. Anybody can get it. It makes the skin go white in patches.
It does. Yes.
And when it affects Black African people living near the equator, they have a terrible time, and the patches of white become very seriously burnt. Big problem. So we living in, if we were living in the tropics, we get badly burnt. And if people come from the tropics to live in where we are in the UK, they become vitamin D deficient.
Yes.
Because their
Yes.
skin does not produce vitamin D, because the melanin, the pigmentation in the skin, absorbs the ultraviolet energy, so it cannot act on 7-DHC.
Mm, mm. Okay, so can we get enough vitamin D from diet and sunlight? Well, that kind of depends.
Well, what it is actually is, in theory, we can get enough from sunlight. In practice, we don't. Say 85% of our population has suboptimal levels of vitamin D. No question about that. So we don't go out in the sun very much. And for half of the year, there isn't enough energy in the sunlight anyway. If your shadow is longer than your height, you do not make vitamin D in the skin.
Really?
That's
Because the
range.
sun's not high enough in the sky.
Yeah, that's right.
So it's not strong enough.
The sunlight is not strong enough, doesn't have
strong.
enough energy. When I said 45 degrees, I don't want people to take out protractors, worry about geometry and things. But basically, at 45 degrees, your shadow is the same length as your height.
I see.
To get vitamin D, your shadow has to be less than your height. That's during the summer.
That's a great tip. That's a great tip.
And of course, we're at work during the day, and when we come home from work, you know, our shadow has got longer. The sun's lower in the sky.
That's
So
true.
in practice, we do not get enough. We do not get enough of vitamin D from the sun, and it's not just in this country either. It's the same in most European countries, because in Spain it's just the same. In Italy, because the people there, they keep out of the sun.
Yes, they do.
You know, we got the poor guy, Michael Mosley, who died expected from exposure in a Greek island. Well, as I say, it was his madness. Only mad dogs and Englishmen go out in the midday sun. True. In Italy and Spain, they have a siesta during the midday, 2 or 3 hours, to keep out of the hot sun and keep in the cool inside, relatively cool inside. So even there, they still work indoors. They still wear clothes. The children still go to school indoors. And even in Southern European countries, there's a lot of vitamin D deficiency, just a mild level of deficiency, not enough to cause rickets, but enough to make the immunity not very good.
Yes, which is interesting. Going on to this next question, what happens if we are deficient in vitamin D? So I suppose there can be a whole list of different conditions, David, depending upon how deficient you are in vitamin D. And the first system maybe to take the hit would be the immune system then.
Yeah, that's right. Immunity is low. Yeah, indeed.
So constant infections.
Yeah. Low-grade infections.
Low-grade infections, yes.
Because we only do get low-grade infections, really. But in COVID-19 pandemic, the people who died were people who are vitamin D deficient. No, if people had good levels of vitamin
D. How do we know that, David? Were they tested?
Yeah, being done.
They were.
Yeah, a lot of testing. Yeah. It was particularly well tested in Israel. Now, Israel's a hot, sunny country, as we know.
It is, yes.
But there's a great deal of serious vitamin D deficiency in Israel because of dress. Because the ultra-Orthodox people, men and women, they tend to stay indoors, and they have very, very extensive clothing. They're not going to take their shirts off when it's sun shining or anything. And there's a great deal of serious vitamin D deficiency. And the research there showed people who had low levels of vitamin D had a high incidence of critical disease or fatal disease from COVID-19. Whereas people with good blood levels, they didn't die. They just had a minor illness. Very convincing research. It's very good indeed.
I know a lot of people do begin to take vitamin D supplements during
Yeah,
COVID,
yeah, yeah,
including myself.
yeah.
So,
So the house telephone is ringing in the background. Oh, it's stopped now. Sorry about that again.
yes, okay. So, David, how do we know how much vitamin D we need and is a safe level for infants, children, adults, and seniors?
Now, vitamin D comes in packets or jars of capsules. And the thing is that it doesn't matter what the dose is on the packet, the size of the capsules is always the same because the capsules are full of olive oil with a little bit of vitamin D added.
Mm,
Now, it comes in units, and like insulin does, it's in
mm,
units.
mm,
And that's the way it should be. There is a move to try and move us into using micrograms, which is a silly idea, really,
mm.
because most people don't know what a microgram is. It's a millionth of a gram. It's not very big at all. It's tiny. A
Okay.
milligram is a thousandth of a gram. We know about milligrams because we take tablets. I take tablets, 100 milligrams a day.
Mm.
Well, I know we're used to handling milligrams,
We
mg,
are, yes.
but we're not used to handling micrograms, which is either a μg or an mcg.
Yes.
And it gets confusing. People will confuse micrograms and take milligrams instead, giving you a times.
Thyroxine medication, levothyroxine, is in micrograms, isn't it?
Yeah, it is. Yeah, it is. That's true. But it's not used very often. And the
No,
point is, you don't go and buy it across the counter.
no.
Like that's used, that's dispensing. You're given a tablet, and it doesn't matter what your doctor will say with thyroxine is, take one a day.
Mm.
Simple as that. It
Yes,
doesn't matter
that's
what
it.
the units are.
Yes.
No, they don't come into it at all. But micrograms is silly. See, with insulin, we still use units,
Mm.
and we should do with vitamin D as well. And
Mm.
if we try to change insulin into micrograms, there'd be absolute chaos.
Mm.
People have to learn something entirely new because there, with insulin, people adjust their own dose, and if they have to change from units to micrograms, it'll cause no end of confusion
Mm.
and danger, quite
Mm.
honestly.
Mm.
Anyway,
Yeah.
so my first recommendation is always use units.
Mm.
Now, when vitamin D was first discovered 100 years ago or thereabouts, it was not possible to measure it as an amount, as a microgram, etc. And it had to have what's called a biological assay.
Mm.
And 1 unit of vitamin D was defined as the daily requirement of a 10-gram mouse. In fact,
Right.
we now know we can now measure vitamin D's weight, and 1 unit of vitamin D is 20 billionths of a gram.
Mm-hmm.
Now, 20 billionths of a gram you can't see.
No.
It's too small to see. So
I can't get my head around that number, actually.
no. Anyway, so if a 10-gram mouse weighs requires 10 units, so 1 unit, a 10-gram mouse, 1 unit of vitamin D.
Yes.
It means that we've got to scale up from there.
Yes.
And 100, I'm going to get this wrong, but basically what it means, someone who weighs 60 kilograms would
Mm-hmm.
require 6,000 units a day. And it works out at 100 grams, 100 units per kilogram of body weight, effectively.
100
100
units
units
per
per
kilogram of
kilogram of
body
body
weight.
weight. Yeah.
Mm.
So if someone weighs 60 kilograms, 6,000 units. If someone weighs 30 kilograms, 3,000 units.
Mm.
And that's the amount that's required. But taking vitamin D should always be followed after a while, 3-6 months, by a blood test.
Well, that was going to be my next question, David. How important is it to have a blood test to check vitamin D levels? So it's not necessarily important to have one prior to taking vitamin D.
Correct.
But it's good to have one about 3 months after.
Yeah,
you
3 months, 6 months later. Yeah. That's right.
Right. Oh,
We, we,
why is that?
because we've got to make sure we're reaching the target. It's like with treating diabetes. We've got to have a blood test to make sure that the blood glucose is controlled.
Mm.
We've got to make sure that our blood level of vitamin D is in that range of 100 to 150 nanomoles per litre. Otherwise, it's not worth taking. We don't want to be left like John Campbell with too little vitamin D.
We don't. What if a person goes to see their GP though and asks for a blood test for vitamin D, and the GP says no, you don't need one?
Well, when I was working doing my research, we firstly obtained blood levels of vitamin D from Manchester University. We were paying £30 per test. And it was quite expensive. So what we did, we bought the equipment costing about £3,000, which came from my research fund. And we did batch testing once a week. And the cost was low. It's only pence for the testing materials. And so a couple of pounds, I suppose. And I must have done 5,000 blood vitamin D level testing, about 5,000, thereabouts, a lot. And the cost was, once we got the equipment, it was dead easy. What we could have done was we could have then said we could have advertised and said, we'll do your vitamin D test for you, and we'll only charge you £20 per time. We'd have made a lot of money, perhaps. And so when there is a big charge, a big cost of vitamin D, it's because someone's making money out of it, out of the testing.
I think you can get a private test for around £25, can you?
You can, yes.
Nowadays,
yeah.
If your doctor, if your GP won't do it for you.
Yeah, and yes, John Campbell did this on his recent YouTube, very recent YouTube, and it's worth watching it actually because he did it and showed you how to do it. It was a good test.
I'll check that one out. I normally like to watch all of John's YouTube videos.
But for most people, if it costs £25, it's not a big deal, quite honestly.
No, it's not. No, I agree.
So you assume that you're deficient in vitamin D, take the vitamin D, and after about 6 months, get a blood test done and see how you're getting on.
Okay.
You won't come to any harm.
So in that same vein, then, David, can we overdose on vitamin D, because it is a fat soluble vitamin, not water soluble?
Yeah, it's fat soluble. Yeah.
Yeah. So can it be dangerous if we're taking too much?
Well, if you're taking, well, I don't actually take vitamin D every day. I take it once a week. I buy from the local pharmacy capsules of 20,000 units. And they take
capsules, not tablets.
Capsules. Well, it's an oil. It's an oil, really.
Okay.
So it's got to be in a capsule, not a tablet form.
Okay.
There are some tablet preparations for it, actually. But do
you think capsules are better?
I think so, yes.
And do you think do you think because there are lots of different vitamin D supplements out there, what about these oral spray vitamin D supplements?
Yeah, I think they're fine. They're good
okay.
for sprays, yeah. Good for children, yeah.
I think, yeah, well, yes, of course, yes, but you'd have to have an awful lot of sprays to get up to 20,000.
No,
that
the
work out
spray
quite
is
expensive.
It's a metered spray. A metered spray of, say, you get 1,000 unit sprays or 3,000 units.
Yes, I've seen them, yes.
I take my vitamin D only on Sundays. It's a bit easier that way. So I have the 20,000 unit capsules, and I take 2 of them every Sunday. And that's fine, rather than every day.
So can we...
And if I forget on the Sunday, I take it on the Monday.
Okay.
If I get it for a week, it won't do any harm. It's not like insulin where you have to take it every day.
Well, no, that's right. It was my friend Jill who told me about you giving a talk at her colon hydrotherapy conference, and you did say at that talk that you took your vitamin D just once a week, and that surprised me, because I suppose I assumed, obviously quite wrongly, that it had to be taken every day.
No. See, a lot of medicines have to be taken every day because the half-life, it disappears quickly.
Yes.
But with vitamin D, it disappears very, very slowly.
And your
Because
body
my blood level is now
stores it,
160.
doesn't it?
If I stop taking vitamin D now, my blood level will still be about 150 in 3 months' time.
Mm,
It's stored in the body. It hangs
mm,
around.
mm.
But when we get infection, the vitamin D that's stored in the blood basically is taken up into the cells,
Mm.
and then it's activated and it switches on immunity.
Yes,
Immunity does not work without vitamin D.
yes, yes. It's amazing, isn't it?
Yeah, it is. Yeah,
Amazing.
yeah, yeah.
But just going back to my question here, then, David, can we overdose? Can we over supplement with vitamin D? And if we do, what signs and symptoms should we be looking for?
Well, firstly, it is extremely difficult to overdose with it. If I were to take 40,000 units once a day rather than once a week, I would probably not be overdosing. If we're taking 100,000 units once a day, that might cause problems. Now, basically, you don't get symptoms from it.
Oh,
You don't get symptoms, no. But the amount of calcium in the blood and the amount of calcium in the urine will increase. So this is why we need a blood test after 6 months, checking not just the vitamin D level in the blood, but also the calcium level in the blood. We want to make sure that we're not taking too much. We want to make sure that the dose we're taking is just right.
so regarding testing, then, I mean, do you recommend a particular laboratory
No,
company?
no, I don't.
No.
I get on. I've had all mine done through the hospital when I was working, and
Okay.
through the GP now. He's happy to do it.
Oh, that's good. Okay, right. Thank you. So yes, and you've already covered this, David. Should we be taking it every day, or can we take a large dose just once a week? And yes,
Yeah.
you've clarified
See,
that.
John Campbell on his YouTube does identify a specific blood test. There are a lot
Okay.
available on Amazon.
Oh,
A lot
okay,
available on Amazon, but they're probably all pretty good, actually.
okay,
And it's the
right.
same with the brand of vitamin D. What brand you take on the bottle, it doesn't matter. They're
That
all
was going to be
the
my next question.
same.
Does it matter
Yeah,
about the quality or type of vitamin D supplement,
yeah,
oral
yeah.
spray? So you wouldn't recommend a tablet,
No, capsules in the main.
capsules?
But
Okay.
we don't know that all the capsules are the same from different producers.
Hmm.
So that's why we really need to check the blood levels.
Mm-hmm.
So if you take vitamin D from one manufacturer, it might not have the same potential as from another manufacturer. But if you
So
get your,
which vitamin D do you take? Do you want to share that with us, David?
it doesn't really matter. I can't. It's upstairs actually. I won't
Okay, no,
bother it
that's
now.
fine.
But if you
So,
go to the local pharmacy and get 20,000 units, or get it from Amazon, that's the other
okay, okay,
getting it from Amazon, it costs about £15 for a year's supply.
that's
It
great.
is very, very cheap.
So, 2 or 3 simple steps that we can take to maintain, improve our vitamin D levels. Get out in the sunlight, obviously.
Yeah,
Um,
yeah,
eat lots of oily fish
yeah,
and supplement.
yeah. And the
Is there
supplements are
anything
the
else?
easiest thing to do.
Yes.
Supplements are easy, and we can all have them, and they're very, very safe, as long as the dose is right, as long as we're not stupid.
What would you recommend for what dosage would you recommend for infants and children? You know, where you might not want to try and obtain a blood sample.
Yeah. Well, usually you reckon for little children, 1,000 units a day.
1,000 units a day. Right.
That's it.
Okay. Thank you.
So once children get to into the teens, my teenage grandchildren weigh about 50 kilograms, I think. So
Hmm.
that they could be taking, say, 3,000 units a day. I
Okay.
wouldn't overdo it. It's pretty
Okay.
healthy.
All right. Thank you.
But the important time to take vitamin D is in pregnancy. It really
Mm,
is.
mm,
Whenever a woman goes to the antenatal clinic for the first time, booking attendance, she should have her blood level of vitamin D tested. The fact it isn't done is
scandalous.
It's scandalous. Yeah, it really
Mm.
is. And they should start taking vitamin D during pregnancy, so that it will help them in the pregnancy, reducing toxemia, PET. And
And how much vitamin D should a pregnant woman be taking then?
I would say about 3,000 units a day is probably fine.
Okay.
Now,
And when you say units, we're talking about international units, aren't
international
we?
units, yeah.
Okay,
I
just to
call it
clarify.
units because there's only one unit. It's the international one, international standard.
Okay.
The same with insulin. We
Yes.
don't talk about 24 international units of insulin. We just say 24 units of insulin, for example.
So, so pregnant women, important for them to take vitamin D to help prevent toxemia. But what about for the baby, the developing baby?
The baby should be born. If the woman has good blood levels of vitamin D, the baby will be born with good blood levels of vitamin D. If the mother's taking vitamin D during pregnancy, don't worry about the baby.
Okay.
At the moment, especially in babies from of Black African ethnic mothers and South Asian ethnic mothers, there is rickets can occur.
Okay, yes.
There can be serious problems with the babies.
Do you mean babies are born with rickets?
Yeah, well, no, they're not born with rickets, actually. Rickets occurs when they start walking.
Yes.
But when they're lying, well, no, not entirely true. But they're not born with rickets, no, but they develop rickets soon after being born, and especially when they're toddlers.
So when the baby is born and the paediatrician checks the baby, rickets is not visible at that stage.
No.
In the leg bones of the baby.
It's mainly when they're toddlers and they start to go on the feet and makes the bones are soft and so they bend when they're trying to walk. Okay. But it should never happen.
No,
it should never ever happen in this country. It's not. We're not living in 1890 now. We're living in 2024.
Well, so now, what's your blood pressure, David? So what is the Department of Health stance on vitamin D supplementation for children, the immune compromised and the elderly? Do they have a stance on vitamin D?
Yes, they do. The government has the Standing Committee on Nutrition, SACN, Standing Advisory Committee of Nutrition, SACN. Now, SACN does not believe that vitamin D has a role in immunity. That's a starters. In its documents, it says there is a suggestion that vitamin D is involved in immunity, but this is not entirely clear, words to that effect. So what SACN would do would recommend enough vitamin D for to avoid rickets in children. So for a child to take 400 units a day. And in fact, that was also the recommendation during COVID-19 of elderly people in nursing homes or rest homes. They should take vitamin D 400 units a day. Well, it's hopeless. No measurements of blood levels at all. And SACN does not recommend blood level testing, and neither does the government, therefore. It's just a disgrace.
But
Now,
there's so much research, David, that illustrates how important vitamin D and supplementation is.
Well, they just don't believe a lot of the research, basically, and they're certainly not up to date with the research. They do now recommend or state that a maximum dose of vitamin D can be 4,000 units a day. So that's fine. So doctors can prescribe 4,000 units a day, which is adequate for most people, quite honestly.
Okay.
It gets them into a reasonably safe range.
Okay, well, that's something, isn't it?
Yeah.
Oh, yes. Well, this is something I wanted to ask you about vitamin D and cognitive health. And, would a lack of vitamin D affect cognitive health and increase the risk of dementia type diseases?
This goes back to pregnancy, really, and the brain formation the brain development, neurodevelopment in the fetus requires vitamin D.
Mhm.
There's very interesting research has shown that babies born in the autumn have a great advantage over babies born in the spring. In the spring, the mother's been pregnant during the winter time, and she won't have any vitamin D to pass on to the baby. Whereas a baby born in the autumn, the mother has been pregnant during the summer, hopefully sitting outside and getting plenty of vitamin D. And if you take, for example, multiple sclerosis, the risk of multiple sclerosis is much higher as an adult in the baby born in the spring than in the autumn. The mother's pregnancy in the summer is protective against multiple sclerosis. There's something else as well. What's the other one? The age of menopause of a woman is related to whether they're born the time of the year they were born. And it's generally speaking, it's thought that a late menopause is a biological advantage, even though it can be a bit of a nuisance. But the baby born in the autumn, the little girl born in the autumn is likely to have a later menopause than the baby born in the spring.
Wow.
There's another one as well, saying that the autumn birth is better for the baby. So neurodevelopment in the uterus, in the fetus, is of vital importance, and it's during the last 3 months of pregnancy that this is happening. The neurodevelopment, the brain development, etc. Vitamin D related. Now, when it comes down to adults, cognitive health, I don't know. Risk of dementia type disease, I don't know, quite honestly. People say that vitamin D will protect you against dementia. All I can say is I hope so.
Yes.
I'm 80 now and I've not got dementia yet, but still, some people might think I have actually.
No, but you're a very active man, aren't you? Physically because of your allotment, but sociably, mentally, yes. And it helps. But that's really interesting what you've just said about the neurodevelopment of the baby's brain and nervous system, and the different timings of when a woman is pregnant, or at least the last 3 months of the pregnancy. I wasn't aware of that. That's very interesting. Thank you.
There's also malignancy, cancers. There's several cancers that are related to vitamin D, and that is low vitamin D levels are found in people with a number of cancers, and they are in particular, I think, breast, colon, and lung, and whether or not vitamin D supplement reduces the risk is not known, but it seems to be a good thing to have a good level of vitamin D.
Well, I had my fit test result come back today. Your results showed that no further tests are needed at this time. And yes, like you, I take 20,000 units of vitamin D once a week.
Okay.
So that was good.
Going back to immunity, we learned a lot from the AIDS pandemic at the end of the 20th century.
Yes.
And in AIDS, there was a high risk of cancers, high risk of tuberculosis, high risk of dementia, and a high risk of cancers in people who are immunocompromised with AIDS. So it seems to do our best for immunity. If we want to keep ourselves healthy, we've got to optimize our immunity.
Absolutely.
The way to do that is to have a good level of vitamin D, around about 150 nanomoles per litre.
Yes, I've made a note of that. And actually, I've got a test downstairs that I've had it for 2 weeks, sitting on the dining table. to check my vitamin D level. So I must get that done.
Okay, good.
And just one more question then, David, please. So yes, if people, sorry about my misspelling there, if people want to learn more about vitamin D, where will they find the best resources? Because I know that you've written about vitamin D, and have you written a book?
Yeah, 3 books actually.
So how can people access your books?
One was a big book a number of years ago called Vitamin D and Cholesterol: The Importance of the Sun, but it's out of print. But if anyone would want a copy, if they send me an email, then I will send a copy as a PDF. It's a big book. It was about 800 pages, a big book, but it's out of print now. But I'm happy. I've got PDFs which can always send out.
So
The other one was
can you share your email address now,
yeah,
please, David?
yeah. Are you going to display it somehow?
I will do, yes. When we upload this video and when we send it out in our newsletter, we will
It's quite a
include your
simple one.
email address.
Yeah, it's David Grimes 1 at
Numerical one.
And just a number 1. David Grimes 1 at mac.com.
Okay, that's great. Thank you so
mac.com.
much. Thank
So
you.
it's quite simple and straightforward. The other book I wrote in 2021, I think it was, with David Anderson. He was the first author. And that was quite a nice, simple, short book on vitamin D and the COVID pandemic as was developing. And then we wrote another one more recently. It came out this year, I think it was actually. But it's a bigger book, a bit more complicated. But the little book is fine, and that's available on Amazon.
But what's the title of the little book?
It's Vitamin D and COVID-19, or COVID-19. Yeah, I think it's Vitamin D and COVID-19. But the authors Anderson and Grimes.
And that's available on Amazon?
It's on Amazon. Yeah.
Right, that's great, thank you. So we will include that as well in the information.
It's available on bookshops also. Get it through bookshops. Get it through bookshops as well.
Oh, okay. I'll double check the title as well.
Yeah.
Right, I think that's it, David.
COVID-19, I think it is.
Yes, I'll double check.
I remember.
That's it from me. I don't know if you want to mention anything else about vitamin D, anything that I've forgotten to ask you, anything that you feel is important.
I don't think so, quite honestly. Yeah.
Have we covered most things?
My notes, which I wrote down. Yeah. Oh, the other thing, if people want to know about vitamin D, the other thing is to go onto John Campbell's YouTubes.
Yes,
and
absolutely.
if you put in John Campbell, David Grimes,
yes.
There are 2 YouTubes which are very, very good. They're a bit long. They go on for an hour, but I noticed we've gone on for an hour, haven't we? Over an hour. But the ones
I know. I've watched those YouTube videos of you and Dr. Campbell.
They're very popular. The first one has been seen 2.5 million times.
I know. That's amazing. But isn't that so good?
Yeah, they're very good. I was watching the second one the other day, and I was quite surprised actually. I thought it was very good. I was very pleased with it. But it's a nice, relaxed style.
Yes. But it's so important to get the information out there.
Yeah. But if people know anything else about it in particular, send me an email, ask a question, send me an email. I get loads of emails from people who I don't know asking me questions about vitamin D. I'm very pleased to answer them.
Oh, you're so good. You're so good. Thank you for that anyway. But I know how passionate you feel about vitamin D and and the benefits of taking vitamin D. And thank you for that.
And my particular concerns with the ethnic minority people as well.
Yes,
I'm very disturbed about their neglect.
Well, I will emphasise that in particular when we send this video out in our newsletter in a couple of weeks.
Okay, Linda.
So I'm going to say goodbye, David, and thank you so much for your time.
It's a great pleasure.
I'm going to end the recording now. And thank you to everyone who's listened or watched this video. I really do hope it's helped you. And if you've got any questions about vitamin D, do please email David, or you're welcome to email Just for Tummies, feelgood@justfortummies.co.uk, and I will email David for you.
Yeah.
So yes, that's it. Thank you, everyone. And David, if you can just hang around for a moment, please, after I finish the recording.
I will.
So we can have a quick debrief.
Okay.
Thank you.
Thank you.
Thank you, everyone, and bye-bye for now.
Okay. Goodbye.